In the 1840s, a hospital in Vienna had a horrifying secret. Nearly 1 in 5 mothers who gave birth there died within days. Doctors called it fate, bad luck, God's will. One young doctor refused to accept that answer, and what he discovered would save millions of lives. But it would also destroy him. His name was Ignaz Semmelweis, a Hungarian doctor working at Vienna General Hospital's maternity clinic. The hospital ran 2 maternity wards. Both delivered babies the same way. Both had the same doctors, the same conditions. But something was very wrong. Women begged not to be admitted to the first ward. Some even chose to give birth in the street rather than go inside. In the first clinic, staffed by doctors and medical students, the death rate from a disease called childbed fever was nearly 20%. In the second clinic, staffed by midwives, the death rate was under 4%. Same hospital, same illness, same city. The only difference was who was delivering the babies. Semmelweis became obsessed with the question, why? Semmelweis tested every theory he could think of. Overcrowding? No. The second clinic was actually more crowded. Diet, climate, the position women gave birth in. He changed each variable, one at a time. Nothing worked. The deaths continued. Then, in 1847, tragedy gave him the answer no one wanted to hear. A close friend and colleague, a doctor, cut his finger during an autopsy on a woman who had died of childbed fever. Days later, he developed the exact same symptoms and died. Semmelweis made the connection instantly. Doctors and medical students performed autopsies every morning, then walked straight into the maternity ward to deliver babies, without washing their hands. Midwives never performed autopsies at all. Semmelweis had his answer. Doctors were carrying invisible, cadaverous particles from the dead to the living on their own hands. This was decades before germ theory was accepted. Nobody yet understood bacteria caused disease. But Semmelweis didn't need to know why it worked. He ordered every doctor and student to wash their hands with a chlorinated lime solution before touching a patient. The results were immediate. Deaths in the first clinic dropped from nearly 20% to under 2%, almost overnight. You'd think this discovery would have made Semmelweis a hero. Instead, the medical establishment rejected him completely. His theory offended doctors. It implied that they, respected gentlemen of science, were personally responsible for killing their patients. There was no accepted scientific explanation for why it worked. Senior doctors mocked him. He struggled to publish his findings clearly. He was eventually forced out of his position in Vienna entirely. Frustrated and increasingly desperate to be believed, Semmelweis grew erratic. He began writing furious, insulting open letters to prominent doctors who dismissed him, calling them, in his words, irresponsible murderers. His mental health deteriorated. In 1865, At just 47 years old, he was committed to an asylum. Tragically, within weeks, he died there from an infected wound, the very kind of illness his own discovery could have prevented. Just years after his death, Louis Pasteur and Joseph Lister's work on germ theory proved Semmelweis had been right all along. Hand washing became the foundation of modern medical hygiene, a practice that has since saved countless millions of lives in every hospital on Earth. Today, medical researchers even have a name for what happened to him: the Semmelweis reflex. Humanity's tendency to reject new evidence because it contradicts what we already believe. Every time a doctor washes their hands before touching a patient today, it's because of a man the medical world laughed at, exiled, and let die forgotten. If stories like this fascinate you, subscribe. Every week, we dig into the strangest true stories medicine has ever recorded.